Welcome, welcome, Alex.
Oh, thanks for having me.
I am so thrilled that you're here today. Alex is Alex Wallace, right? Correct?
Yes.
Okay. Is the manager of a talent brand at the Knot Worldwide. Alex is not just a powerhouse in the world of social media, but she's also a mother to her son Lawrence. What makes Alex's story so compelling is her openness and transparency about her journey through motherhood, fertility, and loss. So today, we're going to dive deep into that and the realities of motherhood, explore the importance of maternal wellness, and really discuss the often unspoken topic of recurrent loss, and specifically ectopic loss. Both she and I have gone through that, and this is going to be a very open and compelling conversation about just our journeys into motherhood and experiencing loss and trauma. Alex and I share that similar story, and we're both incredibly passionate about bringing these conversations to the forefront. And we're hoping that anyone that listens to this or has anyone that's been impacted in pregnancy loss, infertility, or ectopic loss finds this a valuable conversation. So, again, welcome and thank you for being on, Alex. If you
Yes.
could just
Yeah.
give me a little bit of a rundown on who you are, your background,
Yeah.
and then what, obviously we want to know about your motherhood story, but like I think it's really important to know what makes you tick before we hop into that part of the
Yeah.
conversation.
So you already said it, but I think it's important. Trigger warning on this episode for sure. No matter where you are in your journey, you just might not be ready to hear all the things that we're talking about. I know that that was part of my journey too. I just wasn't ready. And so you could save this, come back to it. But I just want you to know if you're not in the right headspace, this might not be the best episode to listen to today, but come back to it. It'll be really good. But yes, I'm so excited to talk about this topic. For me, it is personal, but also I'm just so open about talking about it that I want to be a good resource to people. So, all's to say, thank you for having me. I'm really excited to be here. But who am I? Who is Alex? I am a mom and a wife and a high performer employee, and I work a corporate job. I love movement in all capacities. I was a cheerleader when I was growing up, and I think I grew up in like a very Christian household. My dad is a pastor. Faith has always been really important to us, and to me as I grew my family. And so one of those things was being a mom. I just knew people would ask me. I can remember being little and people would be like, "What do you want to do when you grow up?" And I was like that cringy girl that was like, "I just want to be a mom," because I had a great mom. I had great parents, and I just knew the value of raising a family. And I wanted to do that for myself. And so when I got married to my husband, he also just really wanted to be a dad. And we just knew that right away we wanted to try and have a baby. And so once we got married, we got to it. And until you are trying, you have no idea what that journey is going to look like for you until you start like tracking the temperature and figuring out ovulation and all of that. And so we tried for about 5 months, and I was like, this feels like this is harder than maybe it should be. This is interesting. On our 6th month, I got a positive test and I was so excited and I was so thrilled. And we called the doctor and went and got blood work, and it came back that I wasn't pregnant. And so I was experiencing a chemical pregnancy. So that was my first positive test, was a letdown for our family because we were so excited. We were trying so hard. It had been 6 months. And really, we were kind of a little traumatized because the way that the doctor that we went to told us was like, we don't cry over spilt milk, was like what she said back to me. We don't cry over spilt milk. Meaning, like, we can't get upset that this is happening because you've only been trying for 6 months. But anyone who has been trying or gone through infertility or fertility trauma, anything is a big deal. Like you are, even from the moment you get a positive test, you start planning for this life that you think you're going to have. And so when you get told that that's not going to happen for you, it's the morning of loss that is so different than any other loss because it's a loss that you haven't even experienced. So that was our first positive test that we've ever had in our marriage. And we were like, okay, this is so interesting. So we switched doctors because that was not super exciting for me. And really, everyone says you should try a year. Like you hear that. You should try a year, try for a year and then see what happens. And we can't really diagnose anything until you try for a year. I have always been someone who is really in tune with my body. I know if something is wrong. I know if I just know something is off. And I just knew that something was off. I was like, I just feel like something is wrong. And so we found someone who really listened to us. It was actually a midwife. And so we moved from like the OBGYN to a midwife. And the way that she just cared for us in that and didn't make us feel weird or that we were wrong in feeling the way that we were feeling. So we went through fertility testing. I did things and my husband did some things. And really what came back was undiagnosed infertility. And it seemed as though I wasn't ovulating, but I didn't have PCOS or I didn't have anything like endometriosis, nothing like that was coming back. And so we did one round of letrozole, and which is like Clomid, if anyone has been on that journey. We did one round of that. I remember like testing, I'm an early tester and it's bad. You shouldn't test when you're supposed to, but also do whatever you want. Do whatever makes your heart happy. I was testing and it was coming back negative. So I had texted my midwife and I was like, I think we have to do another round. And she said, give me one more negative test. And so I went and I peed on a stick. It was like 8 p.m. So it wasn't even like the best pee. So I was like, this isn't even going to be worth it. And I like went about my day. I came back to the bathroom and there was like the faintest line. And I just remember being like, okay, I don't get excited, which is something that like is hard to explain to someone who hasn't experienced loss before, but like you just go to don't get excited.
So I've been pregnant 8 times. I have 3 live babies.
Yeah.
I will say that that this is the way that I feel, and when I talk to anyone that's going through this, because it is a common conversation that I have because of what I've gone
Yep.
through, I'm also very transparent about it. I think it's okay to be joyous.
Yeah.
Even if the end result is not going to be a positive one, it's okay to celebrate that pregnancy. And I think that a lot of women who have gone through recurrent loss, when you get that first test, it's like, oh, well, I've lost X amount of babies or I've had this happen to me and I'm not going to get excited until the baby comes. I actually got to the point where I trained my brain to think like, okay, even if this doesn't pan out, this is a blessing. Like I am pregnant. I got pregnant. There is a line on that stick. That baby is etched on my heart forever and always.
Forever and always.
Right.
It's so funny that you say that because I remember I was texting you through this process because you kind of knew this journey.
Yes.
And I was like, I think I'm pregnant. And you were like, you're pregnant today. Like, this is okay to be excited about this. Like so I like remember that conversation too. And I think I was just like, you're right. I should be, I should be excited about this because it is exciting. And no matter what, you can't control any of it, which is so interesting for pregnancy, especially with me. I'm like a control freak. I want to do everything.
Personality plays into that too.
Yes. Like I'm like, what can I control? What am I eating? I need to stop moving. Like I was like, if I sit still and lay down and don't move, then maybe this will be working. And like, it doesn't matter. It literally doesn't matter. And I think I came to terms with that. We'll keep going in the story, but later on down the road, you come to terms with like, you can't do anything and it's not your fault. And these things just happen and it's so sad. But this pregnancy gave us our beautiful baby boy, who is the angel and love of my life. He is so perfect to me. Maybe not to everyone else, but to me, he is amazing.
He's also beautiful. He is a beautiful, beautiful child, and he is so
He is
sweet.
really, really sweet. And he just has like a sweet personality and has been semi easy. You know, all babies are a blessing and there's no easy baby, but you know, he's just been really great. Getting him into the world, that's another story. I had a pretty traumatic birth experience, but that's not what we're talking about today. He got here and we're so happy that he's here. He turned 7 months old and I had missed my period. I had gotten my period back. My milk supply was dipping. There was no way in my brain that I thought I was pregnant. I was just like, I'm postpartum. Your periods are weird. It's not like maybe you just need to eat something different for your milk. And then I was like, well, maybe I should take a pregnancy test because how would that be happening? So I took a test and it came back so positive right away. And I remember being like, I couldn't get pregnant before without help. Now I'm pregnant. I have a 7-month-old. Like, what am I going to do? I'm so scared. I remember just crying, but like being so excited, but also being so scared. And my husband was mowing the lawn. I remember I walked outside. I just handed him the test and I go, what are we going to do? And he was like, this is great. Like, we're so excited. And I had all the symptoms of pregnancy when I had like terrible morning sickness and I was sick all the time. And it just was, no, it felt normal. And so we called the midwife, we scheduled an ultrasound. The worst part of this whole thing is that you wait 8 weeks until you get into the doctor, and that 8 weeks is the longest time because there's nothing you can do. You just have to hope and pray that everything is safe and healthy and happy. And at this point, there was really no reason to believe otherwise, except for the week before my appointment, I stopped getting, all my symptoms went away. And I remember thinking, I'm pretty sure I've lost this pregnancy. Like something in me knew, I was like, I just think this is going to be bad. So I was prepping my husband and I was saying, I just want you to prepare yourself that this ultrasound could be really sad. Like, I just don't have a good feeling about it. My symptoms are gone. I feel energetic. And I was testing and following like the line progression and my lines were getting, not as dark, lighter. Thank you. And so we went to the ultrasound and I told the ultrasound tech this. I was like, I just want you to know if you have to give us bad news, I'm prepared for that news. I didn't know what being prepared looked like, but I felt like that's what she was going to say. And so I laid back on the table and I looked up at the ceiling and I can still see the ceiling to this day of exactly what that whole thing was. And she had turned the monitor to her and I was like, yep, here comes the blow. Here comes the news. And she said, I just don't see a developed embryo here. And I don't see a heartbeat. I see that there is something there, but it stopped developing at like, it looks like 5 or 6 weeks. And I remember saying okay, like going into like survival mode of myself and survival mode of my family. I was just like, my husband's not going to be okay. He will never tell you this, but he's like the most emotional and like sensitive. It's why I love him so much person and will care for everyone else and then care for himself. And I just knew he wasn't going to be able to process. So he said, well, what do we do then? Like how, like he was just like, it wasn't computing to him that we were going to miscarry this pregnancy. He thought there was something like we could do to save
like
this
fix the issue. Yeah.
Yes. And I just remember turning to him and saying, honey, we lost this baby. There will be no baby. Like, we have to figure out the next steps. And he was just deer in headlights. And I didn't have the capacity to like talk him through that. So we're crying, we're both crying. And then we have to make a decision of what it is that we're going to do. Are we going to wait to let my body miscarry on its own? Or were we going to do a D&C and just take care of it ourselves? And either way, there was no baby. So there was nothing like there. It just was personal choice of what it is that you wanted to do. But during this time of all of this, Nebraska was going through abortion laws. And so there was a lot of extra things we had to do. It felt like for us, like we had to get blood work to confirm that I actually was miscarrying. And so this was over the course of a weekend. So on Thursday, I had my ultrasound. Friday I had to do blood work. Saturday I had to do blood work. Sunday it was confirmed that I was miscarrying. So then we scheduled a D&C for Monday. For me, the choice was really simple. I just didn't want to go through a miscarriage at my house. I had a lot of positive memories and I didn't want that to be one that was for me, but I do think it's personal to everyone. And so do what makes you feel the best. But for me, it just felt right to do that. We went to this surgical center that I still can't drive by today. I avoided at all costs. And we did the D&C. It was shocking how easy it was. I think I was prepared for like I had a C-section with my birth with Lawrence, so I just was expecting to be down for the count for a few days, but really it was very strange how quickly you are pregnant 1 second and then you come out of that and you're not pregnant anymore and then you can go on for the rest of your day. And so that was interesting. That loss, I will say, I kind of came to terms with quicker because you hear the statistics 1 in 4 women will experience a miscarriage, and you just kind of are like, okay, I am 1 in 4, and this is what happens here. And I don't know, my brain just didn't really
Right.
go to a place of processing a loss, but it was a loss. Um, and then you get the itch.
Can I ask
Yeah,
after? So, and just to provide perspective,
yeah,
my very first loss is very similar to yours. Just like
yeah,
our story is very much
yeah.
the same, pretty much.
Yep.
So, when I went through it, when I got my ultrasound, I was actually 10 weeks. And they call that, just from like a scientific perspective, they call that a blighted ovum. So,
Yes, that's what I had. Hmm.
yes. So, same situation. I went in, I was by myself because it was during COVID. My husband was not with me. Same thing, felt different. Like
Yeah,
in my mind and in my heart, I kind of knew, but it doesn't lessen the blow.
yeah,
What I wanted to ask you is, like we're talking a lot about the female perspective. How did you feel I mean, like you alluded to him being emotional and like
yeah.
connected already. How do you feel he handled that whole process, and what level of support was he able to provide you in the process?
Yep. So because I I have to talk about my birth to talk about his feelings. So my birth, I was in labor for 33-ish hours. Um and just like it was our first experience. And so just him seeing me in that much pain and like no progression happening, then ending in a C-section, and that was just really hard. So we were so close to that. Like we had only done that just 7 months ago. And so he was like, that was a lot to watch you do that. And any husband would feel that same way. And then to have this experience, I really think he shut off. Like, I think in that time, he was just doing what he needed to do to survive. Like, we were both in survival mode. And if I'm being honest, our marriage, it was hard because we were both dealing with this grief, and it got worse as the story progresses and before it got better. But we were kind of we were parallel, but we were not together in our grief. Like we were dealing with it on our own. And later we learned like I didn't want to trigger him. He didn't want to trigger me. He understood that it was something that was happening in my body. So he didn't know how to bring up the fact that he was sad about the loss, but it is his baby too. And so he was experiencing some grief there normally as he should. So really it was like very parallel, but we were not together on and we were not in sync. And I think that that really affected. And we had a baby. Like we had a
Little guy.
7 8 month
Yeah.
old baby, and we were trying to, stay alive and have sleep. And we were also going through this deep grief of losing a baby. And I think we just rushed through it, the both of us. And even him, I think we just really rushed through it. And he would say, like, I just don't have time to like be sad because I have to go to work and we have this baby. And there's not time to be sad about this because there's just no time. I like have to do this. And if I let myself go there, that I don't know if I'm going to be able to come out of that place of because I know that people talk a lot about, and I don't know what the scientific thing is about this, about like postpartum depression and anxiety for women, but I think something happens with men as well, like some type of
Yes.
postpartum. There's just a shift that happens in your home. There's a shift that's happening in your wife that you are trying to recognize and care for, but also you didn't carry this baby for 9 months. So really it's a stranger to you that you know that you love, but how are you dealing with that? So he was like going through all of that. We know that now. But I would say we were very distant in this time. We were not like really talking about it. I would be crying on the couch and he would kind of not really want to engage because he didn't know what to say. Um, and so it was hard. That time was hard in our marriage, and it wasn't until I started going to counseling that it got better because I was able to give him permission. Like, it's okay that we're both sad at the same time and we might not know what to say to each other, but it's okay that, like, but let's decide to do it together. Like, let's decide to like walk through this grief together, and it may be in silence, but at least we're doing it together rather than by yourself, because that time can feel so isolating for men because it's not happening. It's truly something that's happening to a woman's body. So it's not happening to them, although it affects them at the same level because it's a loss of a child or a baby. And they also, from the moment someone tells them that they have a pregnant test or pregnant positive pregnancy test, they dream up all of this stuff that it's the same thing that women go through. They just don't physically feel it. And so there's probably some, I don't know, guilt in feeling the way that they feel because it's not happening to them, but it does affect them what's happening. I don't even know if that makes any sense,
Oh,
but
absolutely. And I will tell you, with our situation, we had two kids that were aware of what was going on.
yeah.
And my kids to this day, I know they were significantly impacted by it because just even, we're currently, and I'll talk about this a
Yep.
little bit, we're currently going through transferring our last embryo. This is the first time that I've
Yeah.
talked about that publicly, but the boys even mention, because I said, it has to stick. And Ronan said, remember that one time when you lost the baby and we gave you service in bed? Because they were so concerned about me
Yeah.
during that time. And like it's etched in their brain. He was like 2.5, 3. So like
Yeah.
he was not very old. And it's a family thing. Like, and I'm
Yeah.
sure Lawrence, even though he was so little, it impacts every single person in the family. And
Yep.
like you had mentioned before, like the second you get a positive pregnancy test, regardless of it being a chemical or a blighted ovum or whatever the
Yep.
situation is, I think they also call that a missed miscarriage, but they that it impacts your life forever and ever because your life, what you thought it was going to be, what your family thought it was going to be, is no more. Um,
Yep.
and for my husband, I will say his way of showing love and like showing up is to take the brunt of the work, the emotional stress, all of the things in our family. And through this process, I feel very grateful that he was able to pick up and like, marriage is never 50-50, right? Like we talk about
Yep.
that all the time. Like I'm sure you've heard that. I'm
Yep.
sure everyone listening has heard that. But during that time, he absolutely took more of it, but he didn't have the opportunity to grieve the way that I feel like he needed to grieve. And I still feel like that sits with him today. And it's not something he would ever admit. And when he listens to this, he'll probably be like, oh,
Totally.
I was fine. I grieved fine. But like, I really don't think he did because even when we talked about doing this transfer, it wasn't me that was apprehensive. It was
Yeah.
him, and not for adding another child, but for the thought of potentially having another loss.
Totally.
So I think I'm really glad that we're talking about the marital relationship because I do feel like that is something that really isn't talked about a lot, and it can put significant strain on a relationship. And I know it did in my relationship. And I mean, like we're not completely on the other side of this stage of life, but I know that taking that stress of growing a family and having kids off of his plate and my plate will
Yep,
absolutely bring us more back in line with one another.
totally. And it's so funny that you said that about your husband because I know my husband's going to listen and be like, why would you say that I was not doing good? Honey, it's okay. If you're listening, it's okay. But I think too, it's just like, and I will never know fully what he feels about it all. I just am not him, and I'll never, just like he will never know fully what I feel, it's vice versa. And so I do think though, and it's so hard because you're like in the depths of all of it at the time, but just like checking in, like, hey, how are you for real? Like, and even if it's like I can't talk about it, you know what that means for you and your family, but just knowing like I'm here if you need anything, it's not a burden. I may not have the capacity to talk about it in this moment right now, but like at some point we can and we can figure it out. But yeah, that was a lot back then. Especially because we had a baby. And I will say this too, just for anyone that's listening. I want to normalize the thought of fear when you get a positive, unexpected pregnancy test. And I held that guilt along for a long time. And I felt like I willed the miscarriage a little bit because I was so scared. Like, I was like, I don't know if I want to be pregnant. Honestly, I was like, I don't know if I want this. I don't know if this is something that I can do. I don't know if this is something that I want to do. And I'm terrified because they would have been exactly your boys' age, like just very close, like
18 months.
18 months. And which is beautiful. And like, like whatever timing it is now looking back, but I just remember feeling so negative about it. So that when I went and I got the news that it was a missed miscarriage, I was guilty. I was like, oh no, I did this. Like I wasn't excited enough. I didn't feel like connected to this baby enough. And so because of that, that's why we lost. And that's just not true. I think that anything that you're feeling in any stage of wherever you are is okay and normal. Like people have felt that all of the gamut of emotions that you can feel with a test. And I think that we celebrate the celebrations, especially when you have social media in the mix. You see all these beautiful reels of people announcing their pregnancy. And if you don't feel like that, then you must be the wrong person. And I just think that we have to take that away from the conversation because you can still be just, and if you lose, you can still be just as sad. It can still affect you just as much, even if it maybe wasn't something that you planned or that you felt like you wanted at the time. That doesn't change the grieving process for you. So if anyone listening is experiencing that, I just think that that's important to call out because that was my experience. I was very scared. I wasn't ready. And then we lost the baby and I felt guilty but I was still so sad in the same time. So anyway, that's that. The journey does not end there. It feels like that could be enough. And then I would love to be able to say, and we're pregnant with a rainbow baby, but it just got so much worse and nothing that we could expect. So after I was pregnant, lost the baby, we were like, okay, well, if we kind of already had it in our minds that we were going to be pregnant, so let's try and let's do this. So we tried for as soon as we could and we got pregnant that time. And I was so excited. I felt really excited this time. I was like, yes, there's going to be so close. I had gone through all of the negative things before that. Now I was like, yes, we're excited. Let's do this. And I had no idea. I felt so good. I was so excited. It was around my son's first birthday. So now he was turning 1. And it just felt like the right time. We were feeling good. And we had my son's birthday party on a Saturday. And family came into town and it was awesome. And we were like telling people that we were pregnant because family was there and we were just so excited. And that day went on as normal. Sunday happened. It was normal. On Monday morning, I woke up in the worst pain I can ever describe. Like, I don't even know. It felt like tight gas pain, but also like crampiness, like so much so that I spent the majority of the morning on the toilet. Like, I was like, if I could just do a really big poop, I probably will be okay, but like something is wrong. Like something does not feel good. So Ben took Lawrence to daycare. He was scheduled for like a golf tournament that day. And I was like, go to the golf tournament. Like I'm just gassy. And I think that honestly, I don't know if anyone's been to the emergency room before and they just tell you like, oh, you just have indigestion, you just have gas, like go home, and then you spend like thousands of dollars for them to tell you that you have to fart. That was like what I was scared about. I was like, I'm just gonna go to the doctor in the emergency room and then tell me that I have to fart. And that's not what I want to do. So I stayed home for a long time. I was like in so much pain. I remember getting in the bath because I was like, maybe the warm water will help. And after I got out of the bath and I sat back on the toilet, I woke up on the ground. So I had fainted. And I was like, okay, this is not normal that this is happening. And it was getting to the point where I couldn't even stand up straight because I was in so much pain. I could only be like killed over. So I was like, Ben, actually, I think you can't golf. And he was like mad at me about that. He's like, you just have gas. And I was like, no, I really think something is wrong. I just fainted in the bathroom. And so we went to the hospital and they admitted me and they were like, what's your pain on the scale of 1 to 10? And I was like, I don't want them to tell me this is gas. So I was like a 7.5, 8. It was like a 12. I was like in so much pain. And the worst part of it all was that experience at the hospital during that time. I've never felt less heard, less listened to, less understood. The doctor, when he came in, didn't ever address me directly, although I was the patient. He only talked to my husband. And they were talking about like hunting and politics. And I'm sitting there, and so I'm literally, it was like a movie. I'm screaming out loud in pain. And he's like, are you okay? And I'm like, I'm not okay. I'm in so much pain. Can you please give me an ultrasound? I kept asking, can you please give me an ultrasound? Can you please check? I'm pregnant. Can you please check my baby? And they just kept refusing. They were like, no, we don't need to do an ultrasound. We think that it's your appendix, but we can't do a x-ray because you're pregnant. So we're going to give you an MRI. And in this time, they also had checked my blood work and my HCG was high, like so high, like as high as it, I think it was like
before normal pregnancy.
Yes,
Right.
normal pregnancy. So they were like, we don't think that it's your pregnancy. We think it's something else. So we're going to test for everything else. So we went into the doctor around 11 o'clock and they're doing tests on me the entire afternoon. At this point, Ben has to leave because he needs to go pick up our kid from daycare. So I'm alone. I'm in so much pain. They're giving me morphine. So I'm like coming in and out of it. And every time I'm in, like I'm aware, I'm screaming in pain, asking for them to give me an ultrasound. I just can remember myself. Please give me an ultrasound. They wouldn't do it. So then I needed to empty my bladder because they wanted to do another test or something and I needed an empty bladder for it. So I get up to go to the bathroom and I just remember saying, I'm going to faint. And I did. And I went down to the ground. I woke up on the toilet and they're like, they're like in my face, are you okay? And I said, give me an ultrasound. And they said, we're going to check your heart. We're going to give you an EKG. And I said, no, I don't know what I need to do to get you to listen to me. There's something wrong. I'm pregnant. Please give me an ultrasound. And at this point, I'm bleeding. So I'm starting to bleed vaginally. And I'm like, something is wrong with my baby. Please give me an ultrasound. And so they finally did. They gave me an ultrasound. And I remember asking, is everything okay? And she said, I can't tell you until the doctor comes. And that's when I knew that I was miscarrying. I didn't know to the extent, but I knew I was miscarrying because they can't tell you that it's like legal. The doctor needs to tell you. But I'm alone. I don't have my husband. I don't have anything. I'm in the worst pain, worse than childbirth, like the worst pain. And finally the doctor comes in, the OBGYN on call, and she holds my hand and she says, you had an ectopic rupture. There is no more baby. And we need to go to life-saving surgery. So you need to call your husband and he needs to come now. So I remember calling him and I was like, we lost the baby, but you need to come because I need to go to surgery. And she gets on the phone with him and she says, your wife is experiencing internal bleeding. We need to get her into surgery now. You need to come as quickly as possible. And I remember him coming and her saying to him, you need to say goodbye to your wife. Like, we need to take her now and you need to say goodbye. And we didn't know. Like, we didn't know what, I couldn't even comprehend, like, what is an ectopic pregnancy? Why is everyone making this such a big deal? Am I going to die truly? Like, what's happening? Did we not catch it in time? All these things are going through my head, but also I'm high on drugs and in so much pain that really none of it is computing to me. So they wheel me into the room, and I remember it's so cold because you're so naked and it's an emergency room. And I just looked up at the doctor and I said, can you please pray for me? Because I'm so scared. And she was like, yes. And that's the last thing I remember. And then I woke up by myself in the recovery room and I'm like looking around. At this point, it's 10 o'clock. So I've been at the doctor or at the emergency room for like 11 hours at this point, which probably could have been shortened if they just would have listened to me and give me an ultrasound when I first asked for one, but I wasn't listened to, which in my processing, that's the part that hurts like the most, is that I wasn't listened to and no one believed me when I was saying what I was sharing. But we then learned that I had 2 liters of blood in my abdomen from the rupture of the ectopic pregnancy. I had a blood transfusion that had to happen, and truly it just was so much blood. Like, I definitely could have died. The doctor was like, we saved your life. Like, you can die from these things. That's a real thing that happens. And we're glad that you were here when you did and that we caught it when we did, because it was getting aggressive. And we're just happy that you're here. So for a while, that's what I was processing, is like, man, I almost died and I'm so happy to be here. There's this other layer of, I just had a loss and now I'm experiencing that again. And there's this other layer of, like, this is just so close. Like, I had my first loss in June and this happened in October. And that just is so close together that it just felt so compounding. And I was not okay at all, mentally, physically, emotionally, hormonally. Like, everything was out of whack, but I still had to be a mom. And so one day we will tell Lawrence how much he saved my life, because if I did not have him, I don't know that I would be able. Oh, I know. It's like serious. Stasi. I know.
But
If I didn't have him,
like, that's
it's so
so
true.
true. It is truly.
That's why I call him my angel baby. Like, I really believe, like, if I didn't have him, and not that, like, I was not on suicide watch and like nothing like that, but truly just getting out of bed. Like, he was the reason to like live my life, was my son, and that he needed me. There was no way that I could not. I remember getting him up, getting him dressed, taking him to daycare, coming home horizontal, but knowing that at 3:40 I had to get up and then I had to take care of him. And if it wasn't for him, I think I would still be in bed. Honestly, I don't know. Just, he pulled me out of a deep, deep, deep pit of scary place. It does get better because I feel like I'm in a great place now, but in that stage, it was just terrifying. I was so scared. Talking about my husband, I didn't even want him to touch me. I was like, don't look at me, don't touch me. My body felt so medical. I don't even know another way to say it. It just like felt sterile, because I had 3 surgeries now within the span of 9 months. Like, it was very close together. I didn't feel good in my body. I felt like my body had betrayed me in all senses. Like, it couldn't do the one thing that women are supposed to do, which is make a baby. And, like, it did that once and then it gave up on me, is what I felt like. So I was very disconnected. It felt like I was having an out of body experience with my body. Like, my brain was living over here, my body was living over here, but the two were never together, which made it very hard on our marriage. like intimacy was just not existent. We weren't talking. He was trying his best, but I was just not receiving it. And so I just fell into this dark, scary place. And, but also at the same time, just so grateful to be alive, but then not knowing, like, what do I do with being alive now? Like, so I didn't do anything. I was just like, I'm just going to sit on this couch and watch this TV and hold this baby. And that is, the most that I can do. So
So
that's lost scary.
yes, and I want to add a few things. Like
Yes.
having an ectopic pregnancy, um, it's like 1 in 8 pregnancies, so it's a 2% chance of having, no, 1 in 80, right? So a
Yeah.
2%
180.
chance to actually have an ectopic pregnancy. So it is a very scary thing. It is something that can kill the mother. So there are several different ways that ectopics are handled. So in my situation, thank God and praise Jesus, I was under the care of an REI or a reproductive endocrinologist at the time. So they were on it like immediately because my HCG levels, they were doubling, but they were not moving at the rate that they were supposed to. And so I had to do an endometrial biopsy to rule out pregnancy in my uterus to figure out whether or not it was a viable pregnancy or if it was an ectopic. We couldn't find it. They didn't know where it was. And so there are so many different scenarios. So, like, again, trigger warning. And also, you don't have to agree with this, but like in certain situations, medical abortion is necessary in order to save a woman's life. Your
Mhm.
situation could have been where my pregnancy led if I wasn't under the care of the doctor that I was under.
Yep.
Because I was under the care of the doctor that I was under, I had a choice on what to do about the progression of that pregnancy. Mind you, that baby in any ectopic pregnancy is not viable. There's no way, possible physical way that that baby can live outside of the body at any point in time. So I had to make the decision to terminate my pregnancy using medicine. So I had to take multiple injections of methotrexate, which is a cancer drug that stunts cell growth. So it basically kills the fetus. I had to take 2 rounds because it kept growing. So I mean, I could have had surgery, but they didn't know where it was, right? So I think it's really important to recognize that, like you had mentioned, in some states, that's not even legal. You basically, a woman has to wait until they're in your situation where it is a life-threatening situation and they have to have emergency surgery. They could potentially bleed out. Like women die of ectopic pregnancies all the time. And
Yes.
so I think it's really important to talk about because, I mean, not to mention that you were a Black woman going into an emergency room and you were not provided the care, the standard of care. I mean, like, you were not.
No.
And there is so many things that are ethically wrong with that. And I do want to share some statistics on
Yep.
Black maternal health because I think it's important for people to know. Um, so just let me run through it real quick. Like what you went through is not right. Like we've talked about this before, like there is no reason that anyone should be dismissed. But the number of Black women that are dismissed when they walk into an emergency room or with their clinician is absolutely ridiculous. The maternal mortality rate for Black women they are 3 to 4 times more likely to die from a pregnancy related complication than a white woman. This disparity persists regardless of income, education, or socioeconomic status. Severe maternal morbidity. Black women experience severe maternal morbidity, life-threatening complications due to pregnancy or childbirth at significantly higher rates than white women. They are 2.5 times more likely to suffer from these complications. And then preterm birth and low birth weight. Black women are more likely to experience preterm birth and have babies with low birth weight compared to white women. These factors contribute to higher infant mortality rates within the Black community. You add in the healthcare disparity, the death rates are staggering, and it's sad. Like, our
So
system is so broken. I just want to know, like, I mean, I'm sure that went through your mind
oh,
in this
totally.
situation, but I want you to elaborate on the experience a little bit more in terms of being a Black woman and a minority and having been dismissed. Like, gaslighting and dismissal in medicine is typical across the
Yeah.
board, but I think
Yep.
it's only exaggerated if you're a person of color.
100%. So, for those who might be listening and not watching, I am a Black woman, but I am in a interracial marriage. My husband is white. Um, so we just this is how we move through life. We just and our son is biracial. So we just are very aware of situations like this. I think that when I went into the hospital and the doctor immediately didn't even talk to me, that was the first thing that went through my head was, are they not talking to me because my husband is white and it was a what I had a white male doctor and that he just feels connected to my husband. And then you start to think, okay, well, maybe that's normal that they would only talk to the husband, or maybe he's like old school that he would only talk to my husband, like he needs my husband's permission. I just couldn't wrap my head around that. But I was like, that's so strange that he is not addressing me, the patient. That's so weird. And then when my husband left to go, because there was a point of time where I was in the hospital by myself and I didn't have my wedding rings on. So it probably looked like I was just some single mom, Black mom, which, like, not okay either to treat, even if I was a single Black mom, not okay to dismiss my feelings. But I didn't have my husband as my advocate. It looked like I was alone and I didn't have any support. I didn't have rings on, so it didn't even look like I was married. So to the nurses, I felt like a huge shift because that was also during the time where they changed shifts. So like no one knew that my husband was even there before. And so the dismissal and the, like you said, the gaslighting of like, oh, your pain isn't really that bad. We can't give you anything because you're not, you told us your pain wasn't even that bad. While I'm screaming out in pain, like it was like a movie. I'm like, I'm not making this up. I'm not, I promise you this is embarrassing for me. And I just am trying to feel better. And I'm coming to the place that is supposed to make me feel better. Like you're supposed to be caring for me and you're not caring for me. And I'm pretty, I would say, I like to think the best of people until they give me a reason to not think well of them. And I never want to use the race card of like, well, you're just doing that because I'm Black. But it got to the point where it was almost indismissible to be like, if I were to question, if I were a white woman in this situation, would I be treated differently? And I've come to the answer of yes. I probably would have been treated differently. And that is so unfortunate when you're talking about someone's life and how that could have ended. Who knows how much time I had before that became truly severe in that I would have died. I don't know. I don't know the answer. But that I was given every chance to figure out how long it was inching closer and closer to figuring out how long that was. And that was from the simple fact that no one listened to me. They didn't believe me. And they told me that what I was experiencing wasn't real. And that, I don't know if you've ever been gaslit like that to be told, no, 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 what you are telling me isn't right. You're not really feeling that. That is the most dehumanizing experience, especially when it has to do with like your body, like what you're experiencing. How do you know? I'm telling you what I'm experiencing, and it's your job to believe me, and it's your job to treat me. And the part that I'm asking you for an ultrasound and you're refusing that care, that I will never get over. I will never understand that. It could have been solved way quicker if they just would have listened to me and they chose not to. And I just wonder what it would have been like if I was a white woman, honestly.
I mean, that, and that's a fair question, right? Like
Yeah.
I will never know what it's like to be a Black woman, but to see the statistics, to hear the stories, to hear your story and be very connected to, like, my experience through my ectopic was very different than yours.
Yeah.
And I feel very grateful. I mean, like, obviously I didn't want to be in a life-threatening situation. So I do
Right.
feel very grateful that I had a choice in the way that this went, right? And um, this podcast is not intended to be political, and I will make a statement at the end. It's just about basic human rights, right? You being a Black woman in the United States of America should not suffer or be dismissed for medical care for any reason whatsoever. And the disparity is staggering. And the mortality, the maternal mortality rate in the United States, just in general, is one of the highest in the world. And that in and of itself is freaking sad.
Hold
Our
on, pause. Cut this out at minute 50, 30. My dog's going to start barking unless
Okay.
I take it over.
Okay.
It's because my husband came home. I was like, this is not going to be good. Okay.
That's okay. So
50, 45.
yeah. But anyways, I just wanted to make sure that we talked about that because I think that it's important for the community at large to understand that. And I also think it's really important for women who haven't gone through the things that we've gone through, and that you specifically have gone through as a Black woman in terms of healthcare. I think it's an important story to tell, because it provides perspective. And I'm very passionate about maternal health, and I think there's so many different things that we can do, even with Victress, within the Victress community, and how we show up in the world to help change the narrative, because
Yeah.
because loss and infertility has impacted me personally. It has been unbelievably important for me to be open and transparent. I appreciate you being so open and transparent about, like, everything that you have been through. And I know that the story doesn't end here for you. Before we, you know, end the podcast, I really want you to talk about mental health. And I know you had alluded to being in a dark place and all of that. What have you done as an individual, as a mother, as a wife, to get yourself back to where you are currently in terms of your headspace? You had mentioned movement being very important to you. I want to hear how you're moving your body. I want to hear about therapy, all of those things.
Yeah. Therapy, 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 therapy. And this is what I will say about that. It is so important that you find the right therapist for you in the season that you're in. I've been in therapy a lot. Like, I'm not immune to therapy. I love therapy. I think it's great. I think it's beneficial for many seasons. But the therapist that I was using before was not the right therapist for this. And I needed to find that person, and who that was going to be. So when I was ready, this was after my first loss. I got into therapy. And so thank God, seriously, that I was already in therapy during my second loss, because I was able to walk through that with my therapist of processing that. So it might take a few times, is what I want to say. So if you're listening and you are looking for a therapist, I just want to say it is not weird for you to stop seeing a therapist and finding someone else. And maybe you've been with them for years, but it's just not suiting you. So find the one that works for you in the season that you are in, who specializes in your needs. So whether that's motherhood or transitions or loss and grief, like, it just is so important that you find the right person for you. And then the second part of that is committing to the work. So therapy is so good for you, but it only works if you work the system. So you have to be committed to wanting to be better, to wanting to walk through this, to coming out on the other side. but you have to go through it. And so for me, I've again been through therapy a lot where I just went for the hour and walked away and then came back and went for the other hour and walked away. But this time I was so intentional about my processes that I was doing the work outside of therapy. And so that meant journaling and talking to people and allowing myself space. So during all of this, I also was working this corporate job. So I was terrified of, and this is a whole other topic, of being a high performer and was I going to lose my job? And many women, I'm so passionate about this too, who have corporate jobs sit behind their desk like I'm sitting right now and they're miscarrying as they're in a meeting. And I think that we have to allow women the time and the space to be women while working. And so my job, I work for a very great company. They gave me as much time as I needed to be able to take off of work, no questions asked, compassionate leave. And yeah, so I just think you have to be able, and if your workplace is not set up for that, take time, like take the PTO, take the time off, take FMLA. Like there are so many options for you to be able to have the space and time that you need to grieve this major thing that's happening to you. So while I was doing that, I just did the work. So find the right therapist, commit to doing the work. And for a while, I actually was so disconnected with my body that movement was really scary for me. And so I like scary in a way that I've never experienced before. Not that I was scared to do the movement, but I just was like, can I do it? And is it worth it to me?
Right.
And so I stepped away from movement for a while, like a while. And in that time, I gained a ton of weight, like about 50 pounds. Not only because I wasn't moving, but also because my hormones were all out of sync and out of whack. I had been pregnant 3 times in a year. My body didn't know what was happening. I was breastfeeding during that time too, so my milk supply had gone away. So I gained a ton of weight and I wasn't ready. I wasn't healthy and I wasn't ready to move. And so I actually got on Zepbound, which is it's like Ozempic. And truly the reason for that was because I needed to get to a place where I could have a relationship with my body that felt good. And so it was about weight loss for me. And it was about being able to lose weight while not also being in movement because mentally I just wasn't there. I couldn't take on all of that at the same time. So I did a couple rounds of that, a few months of that, and I lost about 25 pounds. I still had some things to lose. And so but I felt better and more capable in my body to do it through diet and exercise the way that I knew. So I joined back with Victress, and I always just felt really like some of my best friends are there. It felt like a really safe space for me to be during that time. But also, my relationship with Victress changed in this time because I needed to be able to show up and leave. And
Yeah.
I think that there was a season where I needed to show up for community, but that's not the season that I was in. I needed a place that I could show up. I knew everyone loved me and cared for me there, but I didn't want to talk about it. And I just wanted to move my body and then I wanted to leave. And that is what Victress also provided for me. So I know we talk a lot about the community that is Victress, and sometimes that's intimidating, but it's exactly whatever you need. Like Victress is what you need it to be. And there are spaces like the way that coaches would just know what was happening and help me modify, but not in a way that was like blasting to the world because I didn't need that at that time either. So now I work out 2 times a week at Victress. I lift weights and I also, this is like the weirdest thing to say, but I am a runner. I like to run now. I used to say, if I'm running, you should start running because something's wrong. But truly, I found like this love of running within the last couple of weeks, I would say, in what it allows my body to do. And I think that because I went through all of this, I was like, your body has done so much. You can run. Like you actually can run. And I can. And so this new relationship with my body has been really exciting to see. I've actually never felt better. I'm not the smallest I've ever been. I'm not the smallest I will ever be. I think that right now it's not about aesthetics to me. It's just about feeling. Like, do I feel good? Is my mind and mind and my body connected? Yes. And for a long time, the answer to that was no. And so I'm just so happy that they are. And we're trying to have a baby. And so we're in the middle of that right now, which is really exciting and also unknown, but I'm just in a place where I want to have a healthy body for a healthy pregnancy. And so those are the priorities for me right now. And I'm happy to be at Victor's to help me do that. I actually worked out through my entire pregnancy with Lawrence. I lost weight. I didn't gain weight in my pregnancy. So my body took really well to pregnancy. And I really think that that's from just continuing movement throughout that entire journey. So I don't look the same, but I also don't feel the same. And I think that that is the best thing. So yeah,
I
that's
mean, we
movement.
all go through stages of life, and I think body betrayal, it's very hard to move your body when you feel so betrayed by it. Like you had
Yeah.
mentioned having that like outer body experience and not being
Yep.
connected to yourself at all. And Lord knows I know how that feels. Like it is one of the I don't know, like that's almost as bad as the loss itself, really. I
Yep.
think, I mean, for me, it was just like one thing after another, and I just was getting so frustrated. Like, do your job. Like, but then, like you do have to, the mental health work it helps because when this is right, you
Yep.
can reframe the way that you're thinking, and we are capable. Our bodies are capable, even with all of the traumas, right? Like all the surgeries, all the traumas, all the scar tissue, all the things, like, and God bless science. I mean,
It
like, yeah, seriously. Like, and for me, I mean, you had a C-section too. Like, I I know that I would have had some really traumatic experiences if I did not end up having a C-section.
yeah.
And so I think that medicine is a blessing, and not everybody has. I would have loved to have had a natural birth. I had plans of having a natural birth. I prepared to have a natural birth, like the lifting through pregnancy, all of that, like it would have been a wonderful experience, but that was not the way the cards fell. And I am very grateful for the fact that modern medicine allowed me to have a C-section, right? Like if
Yep.
that wasn't an option or if that wasn't the recourse for what was going, sorry, the doctor keeps calling.
Oh no.
No, I know. Believe it or not, I had my blood tested this morning, so shall know if I'm pregnant.
Well, do you want to answer it? My goodness.
Should
I'm
I?
scared.
Let me see. Like, let me see if it.
Are they gonna leave you a message?
I
You
don't
can
know.
you cut this out?
Probably. I mean, it's kind of part. It's par for the course.
What if?
Oh my gosh.
Okay. Dear
I'll let you know.
Jesus. Yeah,
Uh,
you let
yeah. But anyways, I think that. Well, first of all, thank you for being on. I mean, we could talk about this
Yes.
for hours, and I feel like we
Literally.
probably need to have another episode eventually just about birth trauma.
Yes.
Um, I also want to make sure that I make a few things clear. Number one, there are so many wonderful doctors in this world, and they go through all the training and all the experience to provide the service that they do and take care of their patients. And we talked about dismissal and gaslighting. Not every clinician or practitioner is like that. Um, and I think that even sometimes, because they are so jaded by the experiences that they go through on a day-to-day basis and the lack of support that they get, I think it leads to that. This is by no means an excuse, but I do just want to make sure that I reiterate that because, like I do believe everyone deserves grace to a certain extent. But it's we could blame the system as much as we possibly want, but like at the end of the day, we are lucky to have doctors.
And although I had a terrible experience, I've also had wonderful experiences with so many medical professionals in that space. So I totally agree. I think advocate for yourself, and only you know what that means to do that for you. Um, is all I would add to that. You are in control more than you know. Yes, they went to medical school. Yes, they have the credentials, but only you know you. And so don't be afraid to speak up for yourself.
Absolutely. Thank you for sharing. Thank you again, Alex. I do want to leave with one statement.
Yes.
It's a pre-written statement about this recording. We may add it to the beginning of the recording as well. This is just a disclaimer. At our core, this podcast is about advocating for women's rights, which we believe are a fundamental human right. The discussions we have and the perspectives shared are rooted in real life experiences of women and are centered on ensuring that every woman receives the care, respect, and support that she deserves. Our conversations are situational, not political, and are focused on the universal principle that every individual has the right to be treated with dignity and humanity. Thank you.
Drop.
Yeah, love you, girl.
Love you too. Bye. Wait,
Bye.
text.
I'll text you.